Welcome back, everyone. Well, today is World Mental Health Day 2017, and if there was ever a time to look at what's being done to address the mental health issues around the world, it is now. World Mental Health Day's overall objective is to raise awareness of mental health issues and mobilize efforts in support of better mental health. Well, from recent devastating earthquakes, hurricanes, and deadly mass shootings, well, the need for immediate psychological first aid and long-term mental health services is capturing the headlines. So we've got Kim Sertivan here. She is a licensed clinical social worker and president and CEO of the Youth Crisis Center with 17 years of experience in serving children and families who have concerns with mental health issues. Thank you so much for being here.
Thank you for having me.
You know, I want to talk about a little bit, YCC has placed a priority on early trauma intervention. And I think that's an interesting statement of early intervention for trauma, because so often trauma can occur, but yet we don't go seek help for trauma until we realize, well, we can't sleep, or it's impacting our eating, or we can't focus. So why did you identify at YCC the need to get in so early when a traumatic experience occurs?
Well, we've really we've looked at our population that we've served over the years, and in the past it's been more or less around at risk, but what really did that mean? And so now we're trying to look at, things occur in children's lives, and if they're not detected early enough, can have a long time effect. It can affect brain development, central nervous system development. It can impact grades and relationships. And so these are things that can have an ongoing effect as an adult. And so we really just wanted to make sure that we can reach these young folks and their families as early as possible after something has occurred, and really just educating on our community, what does trauma really mean and how does that impact someone? So that is our new stance now, is early detection.
And so long there was a stigma about going to ask for help. Oh, you're mentally weak, you can't, you kind of suck it up and punch through it. But now what we're seeing is when we have these mass incidents, that there's actually a huge call out for mental health professionals like yourself to come to gather to an area like Las Vegas. I was reading that they took a conference room in one of the hotels and said, just please come so that we can do like mass casualty, if you will, for those who have been impacted by trauma, not necessarily just physical injuries.
Right, early recovery is really the key. So when they do request for folks to come, it's really looking at assessment. How are you impacted? How is this helping you? How can we help you develop some coping skills immediately about this? Trying to work with those that have been impacted with traumatic events doesn't necessarily mean talk therapy. It can mean other ways that you can help address the issue and stabilize the individual. And so this psychological first aid really is bringing in credentialed folks who have the degrees to understand the crisis intervention techniques to assess and then develop coping skills for the individual, and then help them should they need to reach out, what warning signs to look for so that they can have the tools necessary to get help.
And let's talk about the focus for 2017's World Mental Health Day is also focused on the workplace. So let's say you have 20,000 people at this concert who have been traumatized by the incident, or these folks, Irma, or the earthquakes. Now they're all going to work, and you've got these people who are impacted. What can an employer do to make a less stressful workplace, if you will? And also with coworkers. I mean, sometimes you can see a coworker going through something, and you're hesitant to reach out to them or to, I don't want to say report it, but how can we address the mental health issue that's going on in the workplace, particularly right now?
I think it's important to address the symptoms so that you can provide potential training. You could have a health fair. YCC is looking at doing that in an all-staff meeting. So you really just address the symptoms so that folks are aware, oh my gosh, this is exactly how I've been feeling, but I didn't know what to do. And so you don't avoid it, but you address it, you educate it, and then you can provide them with guidance on maybe how to seek assistance. And I think so many folks fear that if they talk about this, then there's going to be a retaliation, or there's going to be an issue with their position or their job, loss of employment. So I think it's important from top down, bottom up, that we all are in this together. It's very difficult to leave everything at the door, but it does impact work performance. And so if you do notice that a person is not performing at their peak how they have been, you need to talk about that and ask them, is there something going on? Can we be of assistance, and not necessarily avoid that?
I know my brother passed away, and it took about 7 years ago. It took a good year before I think I was really mentally back to focus, and very grateful for the people around me who were so supportive and grief counseling that I was provided. Can you share a little bit more about what YCC offers young people and families as well? And you have an upcoming event to really announce your new initiative and focus on early intervention for trauma.
Yes, we have a variety of counseling services that is in our community as well as on our campus on the south side of Jacksonville. And the primary focus is to really get in an early intervention, address that through counseling. We have residential crisis care services where folks who are not quite sure what's going on in the home and maybe they feel that they need some more intensive services. And so we provide a residential respite period for our therapists to really talk with the child and how is this impacting you, bringing the family together and trying to address that. And so through our event, again, it's really educating folks on what does it mean to have encountered something traumatic, how are we launching this, and why do we make that decision. So the event is November 17th on our campus. Our new logo is in the shape of a butterfly, which when you really think of the life expectancy of a butterfly, it's about transformation. And that's what we're in fact doing with our population that we're serving.
All right, Kim Sertivan, President and CEO of Youth Crisis Center, thank you so much for joining us. And if you would like more information about mental health services available at YCC for youth and families, and also some more information about their upcoming event, their website is www.ycc.org.